with mild side effects.
Good evening and welcome to the 137th episode of the Mild Side Effects podcast. My name is Michał Garliński.
And this is Balázs. Welcome to the most professional pharmaceutical podcast ever.
Hello, Balázs.
Hi.
Good to see you.
Good to see you again.
So, as you might have known, the previous episodes that we recorded had a certain humoristic value. It was a convention that we did eating burgers and fries, and then the previous one was recorded at a trade show, so it was, very energetic and very spontaneous at the same time. Today we are trying to do it a little bit more structured. We're trying to be a little bit more serious because the topic that we want to discuss today is serious. And Balázs, tell me, maybe this time you'll get this right. What topic are we talking about today?
So this time, this will be the nitrosamines, which are less fun than the previous ones. And this will be a semi-serious episode.
So the backstory of the nitrosamines that hit the pharmaceutical market, it came with some contaminated batches of some drugs for cardiovascular disease. And it became, we thought it was an impurity, and it became a very long story for the pharmaceutical industry. Balázs, so tell us, how did it start?
So these nitrosamines were known, but were not so they were not in the front page. And they were known since the 60s probably, that they are potently carcinogenous in animals for sure. And I think they also set limits for food and water and environmental limits for sure. And in pharma, they were occasionally considered for some APIs typically, and also solvents later on as solvents were coming into the topic as well. But they were not treated as a universal class risk. And they were really, the control was indirect. And a lot of it was just paperback based or was not looked at all. It doesn't mean that pharma is bad and we are, we are all pharma for pharma, but it wasn't too much under this magnifying glass.
Mm-hmm. So, Balázs, I remember more or less where I was at that time. Do you remember what was your initial reaction when the news about the nitrosamines first hit?
So it was kept really low, to be honest. And I remember the time then, I think it was triggered by valsartan or something like that. And it was coming through, and we initially thought this was coming through an API manufacturer from China. And everybody was pointing at the manufacturer, it's a low quality product, it's a low quality API, which causing it. But the actions and the reactions were kept low, and everybody tried to keep it. I was working in a big pharma at that time, and they kept it really low. Actually, I wasn't involved. I was doing business development, was not involved at all. It was handled at local level, and it was also not stirring up too much the waters. But what I realized, there were heated meetings and arguments ongoing, and quality teams were working heavily on that for sure.
Yeah, so I remember almost the same. I wasn't working at a pharma company, but still in the excipients field. And my first reaction was pretty similar to yours, that, oh boy, it's a Chinese manufactured API. Probably some contamination, this sort of reaction. So why did it, just suddenly become overnight the hottest topic in pharma?
So this was not only done at one place. It's quite a global action as well. If I look at all the different regions and they now act together It's not only European and not only an FDA and not US based, but it's all over in the world. There is kind of consensus that these nitrosamines are carcinogenous and they shouldn't be in pharmaceutical products. And that is clear. And yeah, the whole chemical family, there's an N-nitrosamine. So the nitrite group reacting with certain amino groups. This is what we are talking about. And which are those impurities? There are thousands of them. Actually, recently 6,300 or 6,277 was identified and classified. Now I think there are 4 classifications in terms of potency. And that's why there is a consensus globally or at most pharmaceutical authorities that this should be controlled and this should kept very low.
Okay. So it started with valsartan, but then it started moving further as it was identified that there are certain, let's say, chemical compounds that are affected the most. Can you tell us a little bit more about that?
Yeah, everybody was looking at APIs, and the initial recalls were related, as we discussed, valsartan, ranitidine, and there were also metformin, not probably due to the same cause or root cause were probably different. And what was also not clear, what was the source? Was it API? Was it during processing? Are those degradation products? Are these coming from solvents or packaging or other impurities? Or excipients, which we will talk about later. So that was also not easy. And whenever we try to blame, why they were not looking at before that, it's not that simple. So this could, and we're talking at extremely low levels. So also their analytics were not present and not ready. And the quality teams had really a hard time to find them.
So they were wondering what the source is. Is it API? Is it the process? Is it the packaging? Right?
Indeed. And this is also still ongoing and it's evolving. Yeah.
And this is, we're right now in the area of 2018, 2019. So until we get to end of 2025, we still have a little bit of time. But Balázs, you mentioned that you worked at the pharmaceutical company at that time. So what do you have any sort of idea? Can give us some sort of hint, some sort of taste of what those first months at those pharmaceutical companies looked like, where they were producing valsartans, metformins, or even ranitidine?
These were surely stressful times for everybody who was producing those, and long extra hours and a lot of heated meetings, typically legal with quality and with regulatory or further players together. So that's for short. And also just for our viewers who are not fully in a pharmaceutical recall, is also sometimes a word, it's a taboo word. You don't use this word, that recalls are not happening, because if they are happening, they cost immense amount of money, and it's also the loss of trust, and the reputation of the company is horrible. On top, plus you are not on the market and your product is listed out from a wholesaler or from a pharmacy chain. All these things together, these are horrible consequences. It's kind of a taboo topic. We want to avoid recalls or even the risk of that at any cost. So that's for sure. Yeah.
And then we, when we're looking at those drugs, the valsartans and the metformins, those are typically the RX drugs, but ranitidine is an OTC, right? So recall of that level.
Indeed, and that's what a very important and good point. If it goes out to the market, you have to not only recall it from your own site or your own warehouse, but maybe from a pharma wholesaler because you work with them. And then also, if it's out on the market, thousands of pharmacies. If it's commercial in a bigger country, 15, 20,000 pharmacies. If you talk about a French recall or a German recall, that could mean thousands of pharmacies. Probably you are not in all of the pharmacies, but that means also the logistic cost and effort is immense behind.
Mm-hmm. Mm-hmm. Balash, so then after these well-known APIs, is there any other APIs that we might not know that were not so popular but are were serious in these effects?
Yeah, so it looks like that. So there was also COVID in between, and that
Mm-hmm.
was shifting
Oh yeah.
focus a bit. And this is a little bit understandable that pharma companies and authorities had different focus during those times,
Mm-hmm.
and now they have a little bit more time to focus on that topic as
Mm-hmm.
well. But any API which has a secondary amino group in it that could be sensitive, or the molecular weight is high with a secondary amino group,
Mm-hmm.
this could be a potential target, and a lot of other factors as well. Now today there are some groups of molecules which are under the magnifying glass. Some of them are antidepressants, and they are in the
Mm-hmm.
family of these SSRIs, this serotonin reuptake inhibitors,
Mm-hmm.
uh, fluoxetine, duloxetines, venlafaxines, these kind of products. But there are also a lot more. And if you talk to formulation experts, they're also looking heavily into big tablets or bigger products because they have more API in it or more excipients, which
Mm-hmm.
could also bring nitrites with them, and therefore they are higher risk products.
I remember from the COVID times that drugs like duloxetine or fluoxetine were in high demand. So that's could have been really a serious topic. Okay, so we let's say we have a chaos period, right?
Yeah.
And like in Greek mythology, out of chaos, structure is starting to come out, right? World is forming.
The world is
Uh,
forming indeed. Yeah. Yeah. And
so
so
so so how did that look when the chaos stopped and the structure started to come out, appear?
yeah.
What the companies started to do?
So of course, there was also a little bit of understanding from the authorities' side that
Mm-hmm.
yes, these are higher risk products because of this impurity. On the other hand, they were also taking into consideration that some of these are life-saving drugs, some of these are
Mm-hmm.
curing or treating depression or diabetes or hypertension. We have to measure and we have to evaluate the risk. And then, so the structure came that risk assessments were forming, and
Mm-hmm.
both ICH and also FDA was giving guidelines on that, how to do that.
Mm-hmm.
That was a good help because at least there was
Mm-hmm.
guidance out. Even other countries which were not strictly following, they were adopting fast
Mm-hmm.
these kind of guidances as well. And the bigger companies, big generic players, they also formed these kind of task forces,
Mm-hmm.
specialists, typically quality and analytical experts and formulation experts to tackle that. And they started also EMA started to classify the APIs and
Mm-hmm.
the impurities. That also helped
Mm-hmm.
to create those risk assessments.
Okay. Okay. So probably a word that was on the words of everyone was these NDSRIs, the
The
nitrosamine drug substance related impurities. So probably people in quality and regulatory were just repeating that abbreviation every day, multiple times, right?
and we learned a lot of abbreviations, and a lot of people learned those abbreviations even they didn't want to. Yeah, yeah.
Especially where some people, when we were talking about the nitrosamines, the typical abbreviation is NDMA, right?
Yes, and
Uh,
this is a this is an impurity, and don't think about MDMA. It's NDMA. It's something
you
else.
stole my joke, Balash.
Very
That's the
sorry.
thing. Don't mix NDMA with MDMA. That's not the same thing. We don't
No, they are not.
recommend either of them,
No.
but I think the latter one is is not as toxic as the NDMA.
Definitely, because, and this leads to us to the limits, which are today in nanograms. And most of
Mm-hmm.
the pharmacists, they are not working
Mm-hmm.
with nanograms, but micro or micrograms. But
Mm-hmm.
nano is really low limits. There are
Yeah.
four classes of them, 18 to 100 and 400 and 1500 nanograms per day, daily intake limits,
Uh-huh.
really low ones. And if you have a high molecular weight impurity, it's very easy to reach,
Mm-hmm.
that
Mm-hmm.
level. Yeah.
So let's move on to the next segment, Balash. Um, so after these task forces stopped reviewing APIs because they knew which ones were the secondary or tertiary amines, right?
Yeah.
They shifted their reviews to the most unsuspected suspects,
Yeah.
which are
To
the
the
excipients.
which are the excipients. And the reason also for that is that they were viewed as, so excipients in the past, they were not manufactured under GMP, and there is, depending on region and registration, still usually following Exipact, following GMP regulations, but it's
Mhm,
a little bit more loose, not as tight as an API
mhm,
manufacturing control. So also the focus was not on them. Now, that doesn't mean that, of course, most excipients, they are not bringing any nitrosamines.
mhm,
That's for sure. What they are bringing as trace impurity is nitrites, yes.
mhm,
Don't think about a lot. We are talking about ppms or even below ppm levels,
mhm,
but that's enough already to form a little bit of nitrosamines in this nanogram limit range.
mhm, mhm.
And what
Okay.
that was a rather fresh realization, and the first guidance came from FDA, I think, in September 2024. So rather recently in pharma
Mhm,
world, that means recent, and it's really the first risk assessment was coming out recently as well for
mhm,
excipients especially. All those excipients has to be reviewed, and
mhm,
the other big task is that pharma companies might ask from their suppliers, yeah, please control your nitrite levels in
mhm,
excipients. Unfortunately, that's not that easy. That it's not just a tap which we would close, and then from now
mhm,
on we won't have
mhm.
any nitrites. Yeah, this is the short story of the
So,
excipients.
so, so basically, for those who are not so familiar, it's like saying, um, the when you're trying to control your cholesterol level, the salad that you're eating is actually causing your cholesterol to grow, right? Because
Well,
that's a
in a way,
that's
yeah,
a certain way of telling an analogy. But
yeah.
yeah, it's basically something has to react with those amines, and the excipients were the ones that could be carrying the nitrites. Welcome to the funny segment of the Mild Side Effects podcast. We don't want to bore you to death with a topic on nitrosamines. Uh, it's an important one, but we agreed that we also want to have fun in our podcast. So this segment is going to be called Lord of the Rings or Drug Name. So it's basically coming from the fact that we often hear these weird drug names. And then well, some of you might also, like us, be fans of Lord of the Rings. You read through the book of Silmarillion and you find these strange names that Tolkien made up. So I've compiled Balash a list, and I'm going to be testing your knowledge about Lord of the Rings and marketed drugs.
This will be a tough one, and there is a confession to be made, and probably we lose a couple of 100,000 followers because of that. I couldn't made it through the Silmarillion.
Well,
That's
if
shameful,
somebody
shameful.
if somebody survives Silmarillion, please comment. we will try to get you some sort of award because I don't think anyone survived that book.
I
Good.
think here
So
you are underestimating the nerdiness of our audience. But okay.
I'm challenging to come forward. I'm challenging to come forward. So basically, when we are going to edit this episode, I will try to use my best editing skills to put the names on the screen. And
Okay.
Balash, you give like a 5 seconds time to answer your give your answer,
Okay.
and I will let you know which one it is. Good. So the two pairs. Let me select something. Okay. The first candidate is Vorondis, and the
Okay.
second candidate is Breyanzi. Which one is the Lord of the Ring character? Which one is the drug?
So Vorondis and Breanzi. Vorondis is a Lord of the Ring character, and Breanzi is the drug. Success?
Yes.
Lucky me. No idea where is Vorondis in Lord of the Rings.
Me neither. A second one. Maybe it'll be a little bit more difficult. Onurek or Idril?
Idril and Onurek with O as Oliver. Okay.
O
O.
N U R E G.
Onureg.
Is the Lord of the Rings?
What was the other one? Ilirek.
Idril.
Idril. Idril is Lord of the Rings. Onureg is a drug.
No. Onurek is the drug.
What is that? Let me. I'm on purpose. I'm just making notes, and I will Google them later on, just for
Google it.
my
Google it.
education.
Google it.
Onureg.
Okay.
Go ahead.
Mandos and Empavelli
Empavelli.
is the drug or the Lord of the Ring.
Is it with double L?
Empavelli is one with one L.
One L. So not like Italian Empavelli. No.
No,
Okay.
no.
No.
Empavelli.
I think Empavelli is a drug.
Empavelli is a drug.
And the other
Yes.
is the Lord of the Rings character?
Yes, Mandos is from Silmarillion. Good. Let's have one last try. Okay. So one is called Faridak,
Okay.
and the other one is Maiglin.
Maiglin. Fardak is my... Fardak and Maiglin.
Faridak. Farydak.
Faridak. That must be a drug.
The Faridak is the drug.
God bless.
So,
Never heard of it.
Balázs.
What is Faridak? Never heard of that.
Well, you know, we didn't put any Eliquis's or any other drugs like that on the list. We tried to use, you know, the least known ones, well, especially that we are not based in the US market, and that's where the originators are. So, Balázs, you did well.
Sorry.
You have 2 and 1.
A little bit lucky somewhere, but yeah, I will. Onureg is an oncology drug, I think, but let's check. Okay.
Check it. Good.
I will check this later
So
on. Thank.
so this was our Lord of the Rings or drug segment name, and now back to regular programming. Balazs, so follow-up question in this case. What excipients could be considered the most for having the most nitrites? Is there any sort of, you can say that this one contains more and this one contains less?
So there is a database for that, and this is rather fresh from 22, 23, and this is the LASA database. It's really good. But every excipient should be controlled and looked at closely, which has a high share in the formulation. And usually the ones which are pure sugars like and like starches and lactoses can be very pure and can be very good as well. But you have to look at HPMCs and MCCs. If they are special products, special low nitrite grades, great. If not, it's better to control them in PEGs, stearates, lubricants, cross-povidones, and these disintegrators could bring nitrites. And what's the worst is also pigments. Pigments can bring nitrites to the story, especially during a coating process. You have a couple of percent in weight gain, and this is some share of it. These are certain pigments, synthetic dyes. They might bring nitrites as well.
Okay. So my suspicion was that it would be something like inorganic pigments rather than organic, but that's an interesting one.
Very much depending on
Okay.
the product itself and how the producer of that coating or pigment is controlling that. Yeah.
Okay. So let's stay on the topic of excipients then. So what are the regulators currently saying about nitrites in excipients? Are they setting any limits here?
Yes and no. So EMA right now in the guidance,
Yeah.
they mention excipients and nitrite content as a risk factor. Yes. And that they also suggest, or not suggest, the marketing authorization holder, they must include excipients and also packaging in their risk assessment, not only the API anymore. So that's definitely there. And there is, to my understanding, there is no blanket cover. Okay, this is the limit, 1 ppm, 2 ppm, whatever ppms. No, because it's so much depending on the formulation and so unique to the product. So they cannot give a blanket cover to that. But rather they refer to the original daily intake limits, which were in the nanograms. And this is the hard part, which I think the hard part is that every formulation has to be checked, and during stability studies, this needs to be controlled and monitored.
So is there still any sort of confusion? Who's responsible for what? Is it the API manufacturers, excipient manufacturers, or the finished dosage form manufacturers? Can you tell us a little bit more about that?
So the responsibility ultimately lies at the marketing authorization holder, the finished dosage form manufacturer, and they have the most responsibility. But we, as we are coming from excipient world, we have our part that we provide the low nitrite excipients, and then we help the formulation a little bit from our side. This is our responsibility, and it's a shared responsibility, what I would say here.
And in the space of excipients, what is definitely needed to be added is that if you are the one who is testing your products for nitrites, you're ultimately winning the business at this moment, right?
It's definitely good to test and monitor, and also, So IPAC also understand that this is a potential risk factor, and they are focusing a lot on that. The one of the challenges is also depending on the excipient you are manufacturing, is that how you develop your analytical methods and how you control ultimately your incoming goods, because usually most excipient manufacturers, they are not fully vertically integrated. You have to buy raw materials from somewhere, which usually comes from an industrial process. Could be wood pulp if we are talking about the cellulose products. very hard to control fertilizers and all these products, nitrite levels. So this is very challenging, and this is what I learned during other trainings from others. So it's not my knowledge; it's others' knowledge that you cannot just stop nitrites like a water tap. That okay, from now on we don't add any more nitrites. You cannot do this because they are there from the industrial processes, from all kind of sources. They are hard to control.
Okay. Okay. So if you were to say like where we are today versus when it began 2018, more or less, right?
Yeah.
What's the biggest change that happened during this time, if you would say, as your own assessment?
My assessment is that there is a much better understanding. There are much
Yeah.
better analytical methods developed, and there are much more products available on the market to make better, cleaner formulations. I have to stop and also tell from my perspective the guidelines how to avoid nitrosamines are very theoretical, and sometimes it's
Yeah.
very, I mean, the ideas are great and absolutely correct, but some of them are very hard to put into practice, like please don't granulate or don't use wet granulation. Now there is a reason why pharma likes to granulate, not because they bought granulating mesh granulators and they want to use them, also a reason, but it's much more on that the API itself, it's not easy to handle. You cannot press them. It's not directly compressible or not easy to fill to a capsule.
Yeah.
You
Yeah.
or you need
Yeah.
to make delayed release pellets and a lot more, depending, of course, on the formulation. And also, this is the challenge that many of these ideas are very theoretical and not easy to put it into practice. And or commercially not viable. That's also in generic business. You are also there. If we have to buy 5 times higher, more expensive excipients, that could really end the generic business there. So the commercial viability is also a heavy question.
And Balash, so I want to ask you about after all these years, can we be still surprised that something suddenly appears? I mean, this is a trick question from my side because we were discussing a case that happened quite recently,
Yeah,
right?
I mean, yeah, and we don't even need to talk about that. But even products which are small dosages and small strengths, 1
Uh,
2 5 milligram dosages, were recalled recently in the US, and from a molecule that you wouldn't really expect.
uh,
Because there are also further factors which are very hard to understand in the beginning. There might be degradation products
uh,
in your formulation, which then generating more sensitive amino groups, which then are formulating
uh,
nitrosamines, and you won't see them immediately, or you won't expect that. So this really needs to be tested, and that takes time. And all the root causes need to be mapped. And this is what we discussed. Excipients, yes, pigments, additives, but also packaging and the
yeah.
right storage conditions. That's also something that we have to look closely.
Do you think that packaging will be now looked at more closer? Because
Can
I don't recall that packaging was
no,
um, scrutinized like first the APIs, then the excipients, right?
not to my knowledge, but I'm
Mhm.
not the biggest packaging expert here. It might be that they will be the next one under the magnifying glass, and next months we will talk about how you find low nitrite packaging or certain type of packaging which conforms. Yeah.
So then that brings me to another trick question. Do you think that the industry is truly prepared to tackle issues like this, or will we see, another surprise coming in 5 years?
I, that this is just really wild guessing, but my
Mhm,
optimistic view is that yes, the industry is half prepared already,
mhm,
looking at APIs, processes, risk
mhm,
excipients, excipients, and a lot of other factors. Yes, it's much
mhm,
better than before. But yes, there will be surprises and there will be surprise recalls time to time. Not a lot.
mhm,
Honestly,
mhm.
maybe I'm overly optimistic, but I don't think that there will be a lot of recalls. No. And we also have to a little bit talk here, if you agree on that, that nitrosamines are unfortunately also around us. That are they dangerous? Yes. Do we meet them almost every day? Also yes. And
Balazs, I mean, one topic that we discuss is the food industry, right?
yeah, indeed. Food industry, and let's talk about the name those food groups which might contain, not might contain, they contain nitrosamines, are all kind of meat products, grilled meat, especially everything what is cured and nitrites added as a salt to cure it, like hams, salamis, all kind of cold cuts. Bacon is in the front line because you usually eat bacon also fried. That also helps to generate nitrosamines and nitrites already in the mix. Actually, we add it during the process, but also in chips, cheese, beer, and all kind of products you would find some level of nitrosamines. You might ask the question, why don't we die instantaneously from those? Because
Balazs, why don't we die instantaneously because of that dose?
Because, God bless, we have also an antioxidant system, and I'm the least expert of cancers and oncology here, but they are not reacting immediately, and also the body has the processes to control that, and also also on down to cellular level, and that this is rather lucky. But it might be that some of the bad results or the bad reputation of bacon or certain cold cuts is also related to those impurities, like it or not.
I will defend bacon with my life.
And this is also very nice because and bacon takes lives for sure. And if somebody asks that, okay, Balazs, but you do you eat less salami and bacon because of that? The answer is yes.
Mm.
And is it
Well, in that case, I think there should be more education on this, actually, because normally you wouldn't hear the word nitrosamine walking on the street, right?
not a common one? No, if unless I'm there and I'm saying it. But yeah.
Balazs, okay, last question. So looking back at the whole story, what is the biggest lesson that we've learned from this nitrosamine crisis?
There's never enough quality people in the pharmaceutical industry, and that product development and reformulations take so much time and energy, and they cost a lot. I think this nitrosamine story is also showing it a lot, and how much it costs to the companies. We also see it when your product is not on the market. It's painful. So my what I take as a key learning that a lot of things can change in regulations, and yeah, those who adapt fast, they survive as usual here as well, and that's because of that.
Wonderful, Balazs. Thank you very much for your knowledge that you've laid out
Thanks a
to
lot for the
me and also
opportunity.
the listeners. So this was episode 137, also known as episode 4 nitrosamines.
Exactly.
Uh, this has been the Mild Side Effects podcast. This
This
was
time,
Balazs.
not so mild side effects.
Oh, yes, exactly. Thank you, Balazs.
Take care.